well-being of our Rwandan children have been always at the heart of our culture, our values. If we really want to have the quality citizen, you need to invest in children.
The early years of a child's life quite literally present the opportunity of a lifetime. What happens or does not happen to a child in the early years can influence the entire course of that child's life, for better or for worse.
Early childhood development is one of the most cost-efficient investments in human capital. Investing in the earliest years leads to some of the highest rates of return to families, societies, and countries. When effective and responsive care by the primary caregiver is coupled with access to and the use of quality ECD services, a child's chances of flourishing and attaining an optimal level of development are greatly increased. For every dollar spent on improving early child development, returns can be on average 4 to 5 times the amount invested, and in some cases much higher. The reach of ECD services can go far beyond young children, and it is also important to stress the benefits to caregivers and society at large. For the most vulnerable, early childhood development can be a powerful equalizer. This in turn leads to a country's sustainable development. The right to a child's development has been accepted and embraced by the international community. Rwanda is a country with a vision, legislating to support children in a holistic manner, incorporating health, nutrition, water and sanitation, protection, education, and interventions that support their full development. Rwanda's integrated child rights policy and its corresponding child care reform strategy ensures early child development is increasingly being put on the agenda for children's rights. These actions enable the healthy cognitive, social, and emotional development of young children and engage the highest priority from government, organizations, communities, families, and individuals for the sake of raising healthy children. Support and commitment for ECD has come from the highest levels of society. Her Excellency Jeanette Kagame, First Lady of the Republic of Rwanda, encouraged all to embrace early childhood development.
Having the policies in place, having the laws in place, having the programs in place is very important, but this is one part. The major and important part is to make sure that we implement what we have been agreed in order to develop our children from the early stages.
National consultations were the major avenue through which views from local communities, districts, provinces, and national level stakeholders were sought to promote ECD in Rwanda. At a results-based management workshop in 2010, an ECD framework was developed, which forms the basis of the ECD policy. It is expected that the implementation of the ECD policy actions will result in a healthier and better educated workforce, providing a large and talented human resources pool equipped with critical thinking and entrepreneurial skills, which will drive forward Rwanda's economy. The government of Rwanda, in partnership with many stakeholders, has worked hard to provide an integrated approach to the ECD structure within the country. This approach takes into consideration the rights of the child across their life cycle. It helps to map out issues affecting them, their vulnerabilities, and identifies critical transitions from one life stage to the next. There are 3 main age periods, from prenatal to the age when a child enters primary school, each of which offers differing risks and opportunities. Brain development starts right from pregnancy. Pregnancy is therefore a time which lays the foundation for future development. The first 3 years of life are a period of incredible growth in all areas of a baby's development. This period is critical for ensuring survival and establishing healthy growth and development into the future. Research indicates that at least 80% of brain development occurs before the age of 3, and that a delay in brain development is increasingly difficult to reverse after age 3. During this period of rapid brain growth, we can prevent an increase in development delays and even reverse them. Frequent and positive parent-child interactions help to accelerate language development and communication skills. In addition to health and nutrition support, Continued cognitive stimulation for children during this period provides increased opportunities for learning through play. The creation of low-cost toys made with locally available materials enables all children the opportunity for increased cognitive development.
By engaging parents to improve nurturing practices and help them to make low-cost toys by using available local materials.
Play and the exploration of the surrounding environment in groups allows more opportunities for the child to interact socially with other children and a variety of adults. This provides valuable experience about society and the world they engage in. All these experiences facilitate a smooth transition to primary schooling. The education and strong involvement of parents and primary caregivers is critical to the success of programs. Ensuring a safe and nurturing environment is provided within the home, school, and the community.
The government of Rwanda is leading the early childhood development, and Upto Foundation, together with other partners, are educating families in positive parenting, early stimulation of children, and by sharing the best examples.
The current model has already shown some promising positive outcomes for small children and their families. Health services, health workers, and community providers have an important role in promoting the development of young children. Focus on ECD and the family will not only give young children the best possible start in life, but is also the best investment that Rwanda can make to achieve its national goals. A sustainable and effective ECD system in Rwanda requires empowered and loving families, protective communities, committed organizations, and coordinated efforts from the government and its partners.
Ikigo numva akamaro cyazangirira nuko umwana wanjye byamufasha mu mikurire akazamenya ubwenge.
Early childhood development is not about the individual, it's about everyone. Together, we can build a better Rwanda for the future.